Hi, I'm Dr. Janaka Goonaratne, consultant physician attached to Colombo South Teaching Hospital, Colombo, in Sri Lanka. Uh, Recently, we have noticed that our change of lifestyles and sedentary lifestyle and increasing job requirements, competitive lifestyles, all has led to the non-communicable disorders like hypertension, diabetes, dyslipidemia, and heart cardiovascular disorders, and so on. So all these are nowadays called as the lifestyle disorders as well. So what we can do is, rather than going for the treatment alone, we can go for the lifestyle changes. That includes the mainly the diet and exercise and weight loss and avoidance of the stress. So those are the main way of controlling these non-communicable disorders. Hypertension is one of the causes that causes the that will lead to the other cardiovascular disorders. And we can see these lifestyle disorders that can occur in the young people as well. So therefore, our main objective is to control these lifestyle disorders by doing the change in the lifestyle pattern. Diet, yes. Diet, of course, we have to control with the calorie restriction. Now, we have seen that we are taking the calorie intake what is more than the requirement, and also the control of the salt intake. Low salt diet has led to the decrease in the blood pressure, and also the avoidance of the fatty saturated fats, fatty food including the saturated fatty foods, and also the we have to increase the amount of fruit intake, fruits, vegetables, and legumes. Those intake should be encouraged. So therefore, thereby we can reduce the cardiovascular risk in the among the young people. Then the exercise, regular exercise is very important. Even walking few steps per day, or we say about 8,000 to 10,000 steps per day is quite adequate for the healthy lifestyle. But in addition to that, brisk walking and exercise, strenuous exercise in moderation, we call moderate intensity exercise for at least 30 minutes and 3 times per week. You can maintain. That's also one of the way of preventing the development of these lifestyle disorders like hypertension and so on. On the other hand, stress management also a way of controlling the blood pressure. For that, of course, yoga and mind training and so on can be those way of living lifestyles will be helpful for patients to prevent the blood pressure getting established, high blood pressure getting established. In addition to that, adequate sleep. That doesn't mean that you sleep for the weekend. That is the at least 7 hours, but maybe depending on your job requirement, it may be at least 5 hours or more. But it has to be a continuous sleep, and then that will lead to the lowering of the blood pressure level and maintaining in a good lifestyle.